Hi everybody, welcome. This is the first mini lesson on the urinary system. I'm going to talk a little bit about the specifics of a blood supply to the kidney in this lesson. So if you haven't gone through and looked at the anatomy of the kidney, making sure you're knowing all of the parts and pieces of the cortex and the medulla and your pyramids and your columns and the apex and all that kind of stuff. So make sure you're covering the anatomy first, and then you can jump in as I want to spend some time on the blood supply because that's going to be very important. And then we'll start moving into the physiological processes of urine formation, how our kidneys filter our blood. Okay, so this slide is showing the blood supply to the kidney. Now, if you remember, may or may not remember, from your blood vessel list, we had the renal arteries and renal veins. So if you remember, the renal arteries branched directly off the abdominal aorta. So coming off of your left ventricle, your aorta went up, arched around, went down, became your thoracic aorta, your abdominal aorta, and then right around where your level of your kidneys are, you had these large arteries branching off of the abdominal aorta to feed the kidneys, and these are your renal arteries. So what that tells you is a lot of blood goes to the kidneys since they're branching right off of the aorta. And kind of the statistics that's thrown around in the textbook is your kidneys filter your entire blood volume every 4 to 5 minutes. So what that means is if you have 5 liters of blood, your kidneys filter a liter a minute. So after 5 minutes, all 5 liters of your blood will be filtered by your kidney. So it's 20 to 25% of your entire blood volume is filtered every minute. That's amazing. And the kidneys are like yay big. They're not very large at all, but they have this huge blood supply. And this blood supply is the key to the filtering. So that's why I wanted to spend some time on it, because I usually don't do a lot of the anatomy in this kind of video lessons, but I wanted to make sure I do because it's super duper important. So you have this very intricate blood supply into the kidneys. That's where the filtering is going to happen. And then you have to drain that blood back into general circulation now that it's clean and filter out of all the waste products and acids and things like that. So we have almost a mirror image of blood flow into the kidney as we do out of the kidney. So the diagram, this guy here, is showing you that alignment. There's some differences. It's not exactly the same, but some of the names might help you remember the path as you are going from the renal artery all the way through the kidney back out to the renal vein, which will deposit this newly filtered blood into the inferior vena cava, send it right back up to the right side of your heart. Okay, so let's start with blood coming into the kidney. So that's our renal artery. So I'll get my little marking pen here. Maybe I'll do a highlighter. There we go. So here's our renal artery. So this is again branching directly off of the aorta. So the renal artery then branches into what we call the segmental arteries. So here's our renal artery. We branch into the segmental arteries. And so then they branch into what's called the interlobar arteries right here. So going back to the anatomy piece, the lobes are kind of those repeating units where the renal pyramids are. So when you talk about the interlobar arteries, it's these guys right here. I'm highlighting them in this picture. So those are your interlobar arteries. All right, so that is going to bring blood out to the cortex. So again, here's our interlobar artery, the red, right? This is a systemic circuit, so red is our oxygenated blood, but filled with things that we want to get rid of. When we reach the barrier between the cortex and the medulla, our interlobar artery is going to take a 90-degree turn and turn into our arcuate arteries. So here we are in our little flow chart here. So arcuate means kind of like turning a corner. So here are interlobar arteries, and then they turn the corner, and your arcuate arteries are always going to be found at that barrier between the cortex and the medulla. So then the arcuate arteries, so now they're kind of running horizontally, then they're going to send up branches that are going out into the cortex, and these are called cortical radiate arteries. Okay, so that's how far we've gotten in our flow chart. So now we have cortical radiate arteries penetrating up into the cortex of the kidney. This is where all the filtering happens. So now we're getting into things that are microscopic. We can't really see it on this picture. We'll see it on another one. But just know that the cortical radiate arteries branch into their arterioles. And then we have a capillary bed called the glomerulus, but this is not a gas exchange capillary bed. This is the filtering capillary bed. Then that capillary bed is drained by an efferent arteriole. So again, this is unique. We're going to be talking about this unique setup a little bit later, but we have an arteriole draining a capillary bed drained by an arteriole. That's not normal. It usually is arteriole, capillary bed, venule. It's a little bit different here. That glomerulus capillary bed is used to filter the waste products out of the blood, not gas exchange. So that's why it's still leaving the glomerulus as being oxygenated blood. And then we pick it up in what we call our peritubular capillaries. There's a venule. Now that we are seeing, we can look at its deoxygenated blood. So we have our peritubular capillaries doing the actual gas exchange, and that drains into venules. And now we're going to start seeing some reverse of this path out of the kidney. We have our cortical radiate veins, right? So now we're coming back out of the cortex. We go to our arcuate veins. So again, now we're going horizontal. So we have our cortical radiate, turning that 90 degrees, arcuate, and then we're going to turn to arcuate another 90 degrees to leave in between the lobes. So here we have our interlobar veins. And so we can see those here, interlobar veins, kind of the same place where we had our interlobar arteries. And then those drain, there is no similar segmental vein. I don't know why this area here isn't called the segmental vein, it just isn't. So the interlobar veins drain directly into the renal vein, and that goes into the inferior vena cava. All right, so that's our blood supply from the renal artery all the way to the capillaries for filtration, the capillary bed for gas exchange, and then draining your kidney back into the general circulation. So make sure you are comfortable knowing the sequence of this pattern. This is blood supply. There's going to be another kind of path of fluid as we get into the physiology, so make sure you are separating blood supply from the filtrate that we're going to be producing at the glomerulus. All right, so renal artery, segmental artery, interlobar artery, arcuate artery, cortical radiate artery, afferent arteriole, glomerulus, efferent arteriole, peritubular capillaries, venules, cortical radiate veins, arcuate veins, interlobar veins, renal veins. Hey, I did that without looking. That's what you need to do. Okay, so I wanted to go a little bit more detail into this area here that we didn't get to see the detail on this picture. So here we go into picking up at the afferent and efferent arterioles and the glomerulus. So again, we'll get my highlighter here. So there's a couple different types of nephrons that we'll talk about. I'm not going to go over nephron structure in this slide, but this is just representing the two different kinds of nephrons. But when we feed the blood from the cortical radiate, so imagine, actually I'll draw a little cortical radiate right here. So imagine this is a cortical radiate artery. So it's going in that, it's radiating out into the cortex. This afferent arteriole will be a branch off of that. So our blood flow is going to be going in this direction, and it will go into the afferent arteriole. So get rid of this so it's not cluttery. So we are going to bring blood, whoa, wrong color. We are going to be bringing blood into the glomerulus via the afferent arteriole. That's this guy right here. And then this little capillary that I'm highlighting, I'll highlight them in both. This is called the glomerulus. Glomerulus. So the glomerulus is the filtering unit. So it's capillary beds again. We'll see this in a little bit more detail a little bit later. This is the filtering of your blood. This is where the bad stuff comes out. And then the glomerulus is drained by the efferent arteriole. Okay, so it goes in. Remember, afferent means towards and efferent means away. So that efferent arteriole then goes to feed another set of capillaries called the peritubular capillaries. And if you take a look, peri means around, tubular means tubes, And these capillaries completely cover all of the tubes of the nephron. So that name really makes sense. So paratubular capillaries that surround the tubes. And then you'll see that it's going to drain via a venule. And that will eventually drain into, oops, get the right color. It will drain into a cortical radiate vein. Okay, so this venule draining that second capillary bed where the gas exchange is actually happening. You can see this is deoxygenated blood now, and that's going to drain into the cortical radiate vein, arcuate vein, interlobar vein, renal vein, back out the kidney. So this is what we can see as far as the blood supply goes to these kind of shorter, what are called cortical nephrons. These are nephrons that are only found in the cortex. This other type called juxtamedullary, if you take a look, they are kind of a lot longer. They dip this nephron loop way down deep into the medulla of the kidney. So we still have paratubular capillaries, right? We have we have the paratubular capillaries. You guys, I'm gonna figure this out. My buttons. There we go. We have the paratubular capillaries around this kind of initial part of these collections of tubes, which we'll be calling the PCT and the DCT. We'll learn those later. But because we have this big long dip of this nephron loop, there's a special name for those paratubular capillaries around just that nephron loop, and it's called vasa recta, which just means straight vessel. So it serves the same purpose as the paratubular capillaries in cortical nephrons, as well as up here in the PCT and DCT of this juxtamedullary nephron. They're just there to reclaim anything that's absorbed out of the nephron. Okay, those are our paratubular capillaries. Now, if we look even closer at that glomerulus that is fed by the afferent arteriole, so here's the blood coming in, cortical radiate artery, afferent arteriole, into the glomerular capillary bed. That's all of these blood vessels here. Okay, and then it leaves via the efferent arteriole. So that's what we've zoomed in on specifically for this picture. Okay, now this is the capillary bed of filtration. So our first physiological process we're going to take a look at is called filtration. This is the location that that's going to take place. If you'll notice, this capillary bed is housed within a capsule called the glomerular capsule. Right here. Used to be called the Bowman's capsule, so you might see that word somewhere else, but they're trying to shift away from the people's names. So the glomerular capsule is this cup almost that sits around the capillary bed and will be collecting all of the stuff that gets filtered out in that process of filtration. If you'll notice, there's two parts to the glomerular capsule. We have this capsular epithelium, it's just the outer layer, and then we have what are called the podocytes, or the visceral epithelium. It is a thin layer of really branchy cells that kind of interlock like this, and it helps to create the filter, the actual filtration membrane that things are going to get filtered out of the blood and get collected into this capsule, which will kind of fill in this capsular space. So if we have a whole bunch of gunk coming out of our capillary bed during this filtration process, it's all going to get collected here and eventually head its way into the nephron in the proximal convoluted tubule the first time. So the blood goes in, pressures filter it, the blood goes out, and once it leaves the efferent arteriole, it's been cleansed, if you will. We'll see some other stuff happening with that efferent blood once it goes into the paratubular capillaries, but this is the major location of filtration, which we'll be seeing in the physiology conversation on filtration. Okay, and just a quick reminder, so I have a picture way back in 231 when you guys learning your tissues. When you were learning simple squamous epithelium, remember I had you look at the glomerulus slide, the kidney slide, because we were identifying this simple squamous epithelium right here. And now we actually get to see it in real life, so to speak, in its job as being the wall, if you will, of this glomerulus. The picture on the right, just zooming in a little bit, kind of a cross section of a couple capillaries. So we can see the capillaries, they're fenestrated, and the reason why we know they're fenestrated is because the pores. So fenestrated capillaries had pores, so they're filtry already in nature. Here's the podocyte, which is part of that visceral epithelium that's kind of surrounding the capillaries, and it creates these filtration slits. So their interaction, these interlocking slits, help to regulate the size of things that can actually leave the capillary and enter into this capsular space that's going to be collecting all of the stuff that's being filtered. All right, so let's take a look at some visuals of the renal corpuscle. The corpuscle is just a name for the glomerulus and the capsule together. So corpuscle includes the surrounding capsule, the glomerular capsule, and the capillaries themselves. So the black and white picture up here on the top, this is an electron micrograph of a corpuscle. And I love it because you can see the intricate nature of these filtration slits, how closely entwined those podocyte extensions are of that visceral epithelium. The drawing here is kind of an artistic rendering of, so here would be the afferent arteriole coming in. We can see all the twisted network of the capillaries. We see the yellow podocytes kind of interweaving, creating that filtration slit. And then the blood will be leaving via the efferent arteriole. And all of this stuff here, that's what's being collected during the filtering process. And that's what's going to leave into the PCT and start its journey down the nephron, which is what all the rest of these tubes are, kind of squished and surrounding it. That's the remaining part of the nephron. And then lastly, here's that histological slide. If you remember, here's our capillary bed. So that's our glomerulus. We can't really distinguish between the capillary versus the podocytes, but we know it's there. Here's the Bowman's space, or what we're calling the capsular space. And then here's the simple squamous epithelium, just kind of creating that bubble around the glomerulus, if you will. And we also use a slide, if you remember, to look at simple cuboidal epithelium, which we can see lining the walls of all of these kidney tubules. So if we're going to go over here to the drawing, these are our simple cuboidal epithelium that line the tubes of the nephron, the PCT, the loop of Henle, the DCT, and the collecting duct. Okay, so that's our blood supply. So we go from very large renal artery all the way down to the microscopic level of the glomerulus and the peritubular capillaries, and then all the way back to the renal vein. So make sure you're getting comfortable with the blood flow into and out of the kidney. And then this arrangement of the afferent feeding the glomerulus drained by the efferent is going to be super important for the physiology of filtration, which is what we're going to do next. All right, see you next time.